Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi, everybody. Previously, we talked about PLAC2 test and its relationship to coronary artery disease. And today we're going to review now the potential of homocysteine and its place in coronary artery disease as well, because its increase does increase the risk of that patient having some sort of coronary artery event. Now, the clinician should know about this because billions of times per second, our bodies add a methyl group to help detoxify different toxicants in our body. Now, this is a phase 2 liver detoxification process. And yes, there are some with a hereditary MTHFR abnormality. I'm aware of that. I know you are as well. If it is expressed, it would cause elevated homocysteine levels, which mean they are hypomethylators. So the higher the homocysteine, the more they are not using methyl groups appropriately and becoming hypomethylators. If you read that in the literature, it's the same. Now, if homocysteine is high, methylation is low. Now, here's what it could mean for you and your patients. You can't produce, if you have too much methylation problems, CoQ10. You can't produce carnitine. And you can't get ATP to be produced properly. And of course, adenosine triphosphate is the net result of all our processes cellularly to make energy. Now, if that's not bad enough, you should be aware that poor methylation is associated with all these diseases: myocardial infarction, cardiovascular accidents, cancer, diabetes, Parkinson's, Alzheimer's, depression, and chronic pain, and that's just to name a few. So the thing is, as a clinician, to follow a few important rules to get an accurate test to begin with. Now, there are many people just take the homocysteine and say, oh, it's high, oh, it's low. It's not that easy. The patient, first of all, the night before has to eat a low methionine diet. Otherwise, the test may come out inaccurately high. They should fast for 12 hours. And the blood has to be on ice in 30 minutes or the homocysteine leaks out from the red blood cells and it creates a falsely elevated study. Follow these rules if you want to get an accurate homocysteine reading. And of course, the treatment should be methylated Bs such as B12, folate, B2, riboflavin, that is, B6, and even zinc. And methyl donors should be added to this course because it's the secondary pathway, which should include either choline, trimethylglycine, and S-adenosylmethionine. You want more information? Go to the website drmitchghen.com. That's drmitchghen.com. And of course, I'm Mitch Ghen.